Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mudupe. Today on the program, we are looking at adenomyosis, a rare condition that affects women, especially older women. It can affect the uterus and cause every period. This is our focus today. Please stay tuned. The conversation begins after this break. The program is still Sound Health on Lagos Television. Joining us this evening is Dr. Fatai Tijani, consultant obstetrician and gynecologist, and he is going to share his expertise on adenomyosis. Good evening, Dr. Tijani, and thanks for joining us.
Good evening, ma.
So what exactly is adenomyosis, and what causes this condition in women?
Yes, adenomyosis might sound strange to people because it's not something that is common, probably because the technique or the expertise to diagnose it is limited. People are familiar with fibroids, exotic bleeding, cervical cancer. So adenomyosis is also a gynecological condition that affects a lot of women, especially in their reproductive age group. And in some instances, even their adolescents, because the symptoms can be life-threatening, give excessive bleeding, the symptoms can limit the quality of life because of the pain and some other things. So adenomyosis simply means that the uterus, many of those people describe the uterus has two parts. That's the muscular part that you call myometer, and the inner lining you call the endometer. So muscles, myometer, the inner lining, endometer. And they don't have their cells. So the muscle has the cells, the endometer have a different cell. So when you now have the cell of the inner lining encroaching into the muscle of the uterus, the lining of the womb, that is the inner lining of the womb, is what is usually checked as menstrual bleeding every month. So when you are menstruating, it is the inner lining that is shedding blood, not the muscle. The muscle can only make a contraction to push out the blood. So when you now have these cells that are supposed to be inside and pushing into the muscle, it typically means that whatever is happening inside is also happening in the muscle, which is not supposed to be. So adenomyosis is that we now have these glands and stroma, as we call them in our terminology, endometrial gland and stroma, encroaching into the uterine muscle. So whatever hormonal influence that we have on the inner lining that regulates the menses, monthly menses, it will be affecting the endometrium inside the muscle. That it's just like something strange, something that is not supposed to be there, that is now there. The characteristic of that thing will continue. Irrespective of the womb is located. So it's also different from that. There's another terminology that we call endometriosis. Endometriosis and adenomyosis are different.
No.
Because of endometriosis is outside the womb totally, and in another location of the body. But adenomyosis is within the womb. and it's causing problem. But the presence of that gland, the endometrial gland, and stoma inside the myometrium.
Okay. All right. All right, Dr. Tijani, thank you so much. You took the question out of my mouth. I was going to ask you what is the difference between endometriosis and adenomyosis. Are they the same? But thanks for that explanation. Now, let us know the symptoms of adenomyosis, apart from every period. And what are the other symptoms?
Yeah, the other symptoms, as I say, because of the activeness of the cells of the endometrial gland and the stoma, that is not supposed to be there and inside the muscle. So every menstrual cycle, when the woman is supposed to be menstruating, those cells will be active. So if those cells are active, it will definitely increase. It's like bleeding inside when they are not supposed to be bleeding. You understand? So it will definitely increase the size of the womb of the uterus in multiple. Because if the size is supposed to be small, it will be bigger because of those activities that are going on there. So among the excessive menstrual bleeding, that is why sometimes the person might even have adenomyosis thinking that she has fibroid. Because sometimes they even do a scan, they might not be able to differentiate between the two. So excessive menstrual bleeding that can even lead to the person having anemia, dizziness, fainting attack. You understand? So they also have the issue of pain, painful menses. Because this adenomyosis, it says that they are sensitive to hormones, to change specifically. And when the woman is menstruating, so they have that pure pain. So when they tell you they have this pain, they have this pain, especially during their menses, or when the menses is about to come, or immediately after the menses, the pain will just be there. You understand? So there is also issue of infertility. Won't be able to, of course, because of the reduced sexual intercourse due to pain. The woman that is in pain might not be ready for any sexual engagement. And that one will also cause some infertility in that woman. Apart from that, the excessive bleeding and other hormonal changes that occur around that time will also cause infertility. So basically it is very expensive, getting menstruation, pelvic pain, especially chronic pelvic pain, dizziness, fatigue, fatigability, somebody is trying to say because of this excessive bleeding that they have had because of that. Of course, when you are having this on and off, there will be reduced quality of life. The manpower, the work, the person going to work, the time hours, the hours the person is spending at work will be reduced. Because somebody in pain will not be able to be efficient at work. And all these things can also cause depression, anxiety, irritability, you understand? So those are just some of the symptoms we have.
Right. Is it possible to have both endometriosis, adenomyosis, as well as fibroid?
Yes, it's possible to have all at the same time. So you always not rely on the gynecologist to be able to differentiate which one is which one for best treatment and management. It is possible.
So tell us, what is the best treatment for adenomyosis?
Well, the final treatment to relieve these symptoms and signs is to surgically remove the womb. That's what we call hysterectomy. The surgical removal of the uterus. But we cannot remove the uterus of a woman that is desirous of fertility and pregnancy. So the other option we now have, depending on the type, because it can be mild. If it is a mild, if the symptom is a mild one, sometimes a very limited treatment, just a mild analgesic and the like will be fine, or just a kind of relaxation will be fine. But for the severe one, the options we have is that you can give analgesic, that is painkiller or anti-inflammatory, to relieve or to reduce the effect, the painful effect of the adenomyosis. Then we have hormonal treatment too, where we give hormones. Because as I said earlier, the adenomyosis is dependent on estrogen. So I want to give some hormones that will counter that effect of the initial hormone that is causing that effect. So I want to counter it. So we have different options for hormonal therapy that we give. Then we're also talking about uterine artery embolization, in which the supply to the womb, you want to stop the blood supply to the womb. With the hope that when you stop the blood supply to the womb, you stop keeping that adenoma, as you call them, that is the adenomyosis adenomyosis happening, you are cutting the blood supply to them. When you cut the blood supply to them, they are going to be, it will shrink over time, and then the symptoms will be released. All the things that hospital treatment that doesn't have to be that need to be admitted in the hospital. So we have the endometrial ablation. Because of the endometrial ablation, we are trying to reduce the endometrium cells by burning them up. So when we burn them up, there won't be that migration or that intrusion will also be minimized. Then we talk about the ultrasound guided focus, ultrasound surgery. There also a new thing that's happening where you use a high frequency ultrasound radiation to burn those adenomas. Then we now talk about, as I said before, depending on the symptoms and the size, for the final concluding treatment for adenomyosis, especially for those that have completed a family size, is to do an hysterectomy. People also talk about biopsy. You can take a biopsy of those things to have a biopsy diagnosis of it. But topical removal of the wound that we call hysterectomy is the final solution. Other options are open to those that are not ready for surgery, that are not fit for surgery, or that are desirous of more pregnancy, or they have not completed their family size.
Okay, I know for endometriosis, women as young as 18 experience this condition. Have we seen such cases with adenomyosis? And can this condition be triggered by lifestyles or other health complications?
Yeah, as I said in my introductory remarks, we know say though it is common, the commonest time we have is the age group. We have this symptoms, the age group, because the age is a risk factor. So it's usually found in women in between 35 to 50 years of age. But it doesn't mean, as we say, that the symptom is never say never. In 2 to 5% of adolescents, you also see this adenomyosis. Adolescents that is having every menses or careful menses, in few of them, in no percentage of them, with the right tools and diagnosis is made, we can find adenomyosis and diagnosis in this age group. So the lifestyle, yes, the lifestyle can worsen or reduce that. Because as I said, some of them might, you might not even know that the person has their symptoms. You understand? I think it is mind. The lifestyle modification like rehydration, taking rest, exercise can help. Because the real cause of adenomyosis, the exact cause is unknown. But there are theories that try to explain why this could happen. You understand? So that's not how we want to talk about the genetic aspect, the lifestyle aspect, all those things contribute positively.
Your final words, your call to action, your advice to persons living with adenomyosis.
The final word is just that with men in that age group that we have talked about, particularly 35 to 50 years, sometimes lesser, they're having these recurrent symptoms of pelvic pain, chronic pelvic pain, excessive menstrual bleeding, painful menstrual bleeding, and it is best to approach the hospital to meet a gynecologist so that we'll be able to differentiate and make a diagnosis, because one person and one thing can be considered symptoms. But adenomyosis, if it is not well diagnosed, can be missed. Because as I said, even though you do a scan, you might not be able to differentiate between it and ultrasound. But if the right personnel is approached and the hospital is approached, the right diagnosis can be made and treatment can be instituted as soon as possible.
Dr. Fatai Tijani, consultant obstetrician and gynecologist on how to live with adenomyosis. Thank you so much for your time and expertise on sound health. program is still Sound Health on Lagos Television. More to come in a moment. Wow, this is where we say thank you on today's episode of Sound Health. Whatever symptoms you're experiencing, you do not have the right knowledge to treat yourself, reach out to the nearest health facility. For comments and inquiries, or you have topics you'd like us to treat, please send SMS 30035 to 6603 or follow us on social media at Lagos Television # Sound Health. A sound health is a sound mind. Make healthy living your choice.